you come on in and as you join in on the session, I will let you know that my name is Jenny Anchondo and I am your host for this SARE National session. I'll be here as your moderator, as your go-to person if you have a question. It's one that will be critical probably in all of our lives in terms of understanding our financial future and just our stability in our later years. Today's guest is Rhonda Romero, and the topic is Social Security Retirement Benefits 101. Don't you dare tune out. Don't you dare stop and think, I'm not sure I need to know about that yet. It's absolutely critical for all of us. So let me tell you a little bit about her credibility and what she brings to the stage, because really, I mean, she has been living this day in, day out for a long time. She began her career with the Social Security Administration in 2001. And then in 2014, she became the public affairs specialist for New Mexico and areas of West Texas. Right now, she serves on the Social Security Administration's National American Indian and Alaska Native Policy Work Group and the Dallas Regional Native American Council. So she's covered lots of different areas and lots of different regions. She does hold a degree from the University of New Mexico. She's a native of Santa Fe, New Mexico, where she currently resides. I'm in Dallas, New Mexico is always where I want to go on vacation. So I feel like you are living vacation vibes day in, day out, but also bringing us some education. And I will also let you know, everybody, this is part one of a two-part session. So whether you are catching the replay on YouTube, as I know a lot of you will, or you're live with us during the session, just know that there will be a part two and a follow-up, and also know that there will be time at the end of this session to get your questions answered. So as soon as one pops into your brain, type it into the chat and I will take notes and continue the conversation on the back end. All right, I don't want to take up any more of your time. Rhonda, I'm going to mute myself and let you take it away from here.
Awesome. Thank you so much, Jenny. I really appreciate the invitation to speak to your group, your members. It's very important. And as you know, I cover all areas, like you mentioned. I'm very involved with Native American groups nationally and in New Mexico. But mostly here at home in my personal life, I'm very involved with the Latino community. Being a Latino, a Latina, it is so awesome to present to national groups and organizations that just have so many cultures, everything involved with them. And so what I always love to do, and I explain my job as the main thing of my job, 21 years in the agency, is to dispel any information your ex-sister-in-law gave you at the last family Christmas. Whatever you celebrated, I'm sure Social Security is always a topic. And I just want to make sure that you're going to be the one with enough diddly information, to help people actually and dispel any rumors. And I'll answer a lot of questions, I hope, during the presentation. I'm going to touch on everything that the agency offers. So I am going to start by sharing my screen now, and I actually get off camera while I speak, but just, I'm just going to give a quick tidbit. It takes us, when we start with the agency, 2 years where we have somebody breathing down our neck and reviewing our work. We are baby people in SSA, 2 years to learn our job. And it takes us 3 years to be comfortable with our job. And during that time, it evolves, it changes, information, is coming in, it's the government. And so please know that the information you're going to get today, it's going to be a lot. And please don't expect to gather everything. You may, and I will want to hire you then, gather everything right away, because it is a lot of information and I'm touching upon everything. So, our website is an amazing source. So I hopefully will answer almost everything today, but I'm going to keep referring to it just in case, because it is a lot of information at one time. And in case you don't grasp it all, please know it's because it's quite a bit. We didn't either when we started working here. So, Social Security with you through life's journey. Now, that is a big part of our motto, I should say. And usually what I like to retitle it is Social Security, you are going to see us one way or another. Because, as you know, with your journey with Social Security, most of us, unless you're young, very young, like my son, we got our first Social Security number when we started to work. And so you went in there probably at 13, 14. And when you got your first job, that's when the numbers used to get assigned. Well, now, most people will get their number issued at birth. And so then you will see us again through life if you get married, if you get divorced, if you get married and divorced again, like I did, name changes. And then you will also see us again when it's time for retirement, which is actually one of the best times to see us. That's usually when everybody is pretty happy to walk into a Social Security office. You'll see us if you need to replace a card. And sadly, if there's a death in the family. So we touch your life in many ways. And one of the ways we're going to touch your life is definitely through retirement. So with retirement, I like to always show this slide because it's a building block. It is part of many pieces that you need to get prepared when it's time to retire. Now, for most of the nation, especially here in New Mexico, where I am based out of, it's a main source of retirement. So it means a lot to a lot of people, but it was meant to be building blocks. And I always say, think of it like a stool, 3 legs, not so sturdy. Add in another leg, it's going to be a lot sturdier. So it's part of building blocks. Social Security, then if you have a pension from somewhere, savings and investments, not all of us have that actually, and other income. Now, other income can mean whether you're going to continue working into retirement when you maybe file for Social Security and have a part-time job, or maybe you're married and other income could mean from your significant other. So what is FICA? And we all probably remember FICA. I know I did when I got my first job. You would add up the amount of money. You think, okay, I make this much an hour and I'm going to work this many hours a week. Add it up, boom, I'm going to get that much. Well, you saw something when you got your first check and it was a little less than you thought, and that was because of FICA, and you probably weren't happy, just like I wasn't, or my son wasn't with his first job, and you complained to your parents. Well, now you can tell your children exactly what it is. It is the deduction. And so Social Security is a self-funding program, meaning we actually, those of us paying into the system now, help individuals who receive a benefit. So the total tax is 15.3% of your gross wages off the top before taxes. You and your employer pay for 50-50. So your employer pays 7.65% and you pay 7.65%. Now that's broken down. 6.2% of that is what you pay goes towards Social Security. And another percentage to build it up to 7.65 goes to Medicare. Now, this is what funds the programs. So it's very important. And I always like to describe when I start talking about my agency and all the programs, I go into retirement first. So that's the first thing you get with that 6.2%. And then there's going to be a lot of, but wait, there's more coming with that. We love statistics. We love numbers. We love acronyms because we're the government. Now, 63.1 million individuals receive a benefit from us each month. That is a lot of people. And what also is interesting is SSI, which is a welfare-based program that doesn't come from the Social Security funds, it's general funds. That's a needs-based benefit. There are individuals that receive both of that. It's supplemental security income. So a lot of individuals are receiving benefits each month from us. So it is very important. How do you qualify for benefits? So I explained what FICA taxes are. Well, the next part of it is going to be how does this all kick in and what does it mean? And how do I get there? How do I get all these quarters and credits and everything you hear about? Well, you need 40 credits, or we also call them quarters. It's 10 years of work with Social Security. You have to be 62 or older in order to file a benefit on your own record. Each year, these credits cost a little more, and that's because of the cost of living increase. So $1,640 is what will give you one credit this year. Now, remember, that's taxable earnings. So that's that FICA taxes have to come out of that $1,640 amount. The maximum you can get in quarters, I'm sorry, I say quarters, but it's credits on the screen. I'm old school, been here too long, is 4 per year. How much do you have to pay FICA taxes on in order to get all of your credits this year? $6,560. And it goes up a little bit each year. So that way you can kind of pay attention and see, well, what am I going to get each year? How many quarters did I pay? And also, if you are self-employed, I forgot to mention that if you are self-employed, you're responsible for that full amount of FICA taxes. So you need to pay not just 6.2, you're paying 12.4% into Social Security plus the Medicare percentage on top of that. So if you're self-employed, remember this quarters that you get in order to get coverage under Social Security, you have to be paying FICA taxes on that amount, not federal or gross receipts. That's different. So I always clarify that just so everybody knows. And if you have a tax professional, they're going to let you know. But if you're doing it on your own, just remember that. How do we determine your retirement benefit? Well, we adjust it over time. But the main way we do it is we find the monthly average of your 35 highest years. So remember, that's when you first started that first job at 14, making $5 an hour, if you were lucky. And it's also the job you retired at. So we go on those 35 highest years. If you worked above 35 years, paid into Social Security on all of them, we're going to toss out the low numbers. So 30, let's say you worked 40 years, we're going to toss out the lowest 5 and just compute those 35 years. But remember, if you only worked 25 years paid into Social Security, your working career, and that's all you have when you turn 62, we're going to still do 35 years, but we're going to factor in 10 years of zeros on that. So just remember that. And then it's this fancy word called average indexed monthly earnings, and that's what we go off of. And it usually off of that amount, it's about 40%. So the biggest question, there are two. When is the best age to start receiving Social Security retirement benefits? And that is the biggest question I actually get in this job. It's the reason I had many calls late at night. My mom used to hand out my number to every person that mentioned Social Security. She was a casino supporter. And so I used to get these random calls from people asking this question. Well, it depends. And I'll give you that answer because there's a lot of factors. So at age 62, that's the first year you're eligible to file if you've paid in those 10 years of work. But at age 62, we call that early retirement. And early retirement, what that does is your benefit amount would be 75% of what you paid in to Social Security. You know, after all that, what I just gave you, how we determine your benefit, you get 75% of that at 62. If you hold out and wait till full retirement age, and I'll get to that in a couple slides, full retirement age is when you would receive 100% of what you paid in. And for many of us, it's going to be different ages depending on the year you were born. So if you were born after 1960, your full retirement age would be 67. And that is what my age is going to be for full retirement age. So it's awesome because that's what this chart shows. And they show easy math. which is awesome because I was a history major and a psychology major. And so math is, not always my forte. So this is awesome right off the top of my head. 67 would be when you would get 100% of your benefits. If you defer till age 70, now 70 is the same age for all of us. That's when you would get 132% if you defer. What it does is each year you do not take a benefit, beginning at age 62, your benefit increases by about 8% each year. You hold off filing, but that's up to you. So you really got to look into that. Can you afford to retire early? Maybe, you're in poor health. You need to retire early now and get that money. Or you still want to work. And so you want to continue paying in and you don't want to get into Social Security just now because maybe you don't want that tax bracket to increase. So there's a lot of factors, and there's also life expectancy that goes into that. If your parents are going into their mid-80s right now, you may want to defer because you may need to get more money and receive it for a longer amount of time. So the benefits chart, what I mentioned earlier that I was going to show you a slide. So the year of birth is on the left. So figure out when yours was. I'm sure we all know. And full retirement age is when you would get 100% of what you paid in. And for each of us, that is different depending on the year you were born. Once you reach full retirement age, if you hold off filing until then you get 100% of what you paid in, plus you can work and earn as much as you want through wages, and it's not going to affect your Social Security benefit. And I'm going to explain that in a couple slides. First, I'm going to touch also, this is a fancy word. We love acronyms, and it's because we have these big words, windfall elimination provision, WEP. So if you had a pension, or you're going to get a pension based on work that isn't covered by Social Security, you're going to be affected by this. And what it is, it's an offset. Your employer, let's say you are one of these people, and a lot of times it's local government, it's county government and or city possibly, and maybe law. It's usually law enforcement who do not pay into Social Security. This isn't all law enforcement, but a lot. Also, teachers sometimes don't pay into it. I believe in Texas, that's what is done. So you're going to be affected by this provision. And it works this way. Social Security, your employer came to Social Security and said, hey, we have this awesome pension, and we would prefer our members, our employees, paid into our pension, but not into Social Security, because we can match what Social Security pays back, or we're going to do better than it. And so it's an agreement. So just know, and most of you do, if you work for this type of or you've worked and had this type of retirement plan, there's going to be an offset. So your computation is going to be a little bit different than the rest of us that continuously paid into Social Security. But don't worry, your benefit amount is going to be lower with Social Security, but that is made up by what your employer pension will pay you, just so you know. It won't disadvantage you. So I had mentioned earlier about full retirement age and working. So can you work and receive benefits while on retirement? Yes, you can. So under full retirement age, remember that 66 to 67 time frame that we are under to get 100%. If you're under that age, you can make up to $21,240 a year this year. It increases a little bit each year, depending on the cost of living increase. But if you do make over that, remember that's wages. It doesn't mean your retirement benefit from, another agency that you're going to receive. What it means, it's wages. And for every $2 you go above that amount, your benefit will be reduced by $1 with Social Security. So let's say you file at age 62, but you want to work a part-time job. Well, if you go over this amount a little bit, you're going to have a reduction on your benefit. But the month after your full retirement age is reached, so I would turn 67 in August, end of August. So end of September, I could actually, by then, I'll be able to work and earn as much as I want with no reduction. So that is something to consider when you file for benefits. You know, you have all these options with it. Now, biggest question, as far as when I do these presentations is the spouse portion, spouse and divorced spouse. This is the wait, there's more part. You are entitled to your retirement benefit, but there's a possibility your spouse could be eligible for a benefit off your record. But there are certain criteria that has to be met with that. And I'm going to give you some info here. I hope it doesn't sound too confusing. So the maximum they could receive your spouse off of your benefit would be 50% of your unreduced benefit. By unreduced, that's what you would get at 100% when you would be that full retirement age. So how do they become eligible? Their Social Security benefit has to be less than what your benefit would be at 50%. So for easy math, I mentioned it earlier, this is how I do the example. Let's say you're going to be eligible for $1,000 off of Social Security for yourself. That means your current spouse could possibly be eligible for 500 of that. So that's the 50%. But they're only going to be eligible for that 50%, that 500, if it's more than what they would receive on their own benefit. So if, let's say, your spouse is going to be eligible for nothing with Social Security, maybe they worked in the home, you know, self-employed, where they didn't have to pay, you know, FICA taxes on it, possibly, then they're not going to receive a benefit. Well, then they would be eligible for that $500 off of your benefit. It doesn't reduce your benefit at all. So that is the big perk of this. It's on top of your benefit. Now, let's say your spouse would be eligible for 200 on their own benefit. Well, what Social Security does is they do a combined amount. So we see 200. Okay, well, that's still less than 500. We're going to bring them up to 500 and do 300 coming from your amount. So 300 kicks in from your Social Security benefit. They get 200. Still doesn't reduce it on your benefit. It's just how it's calculated. So they could possibly be eligible and vice versa. The thing with spouses benefits is you as a spouse, if you're claiming on your spouse, you cannot collect until your spouse files. So they have to be 62 and file a claim for retirement, and then you're eligible to file a claim. Think of it like a bank account. They have to open it for you to get any money out of there. So same thing applies. They're still full retirement age. You get more the longer you wait to file for Social Security. You can always file as early as age 62, but if you wait until full retirement age, that's when you would get the maximum amount. And there is, of course, always a reduction when you file early, even when you're filing as a spouse. Now, here's the ooh and ah and the big question part of the presentation. Is benefits for a divorced spouse. Yes, there is a possibility that your ex-spouse can get a benefit off your record. I'm sorry, or maybe congratulations if it's the other way around. It's still the same computation though, but there's eligibility factors that go into this. There's criteria. So the marriage has to be 10 years, has to be 10 years. You cannot be married to anybody else. And you have to be 62 or older. So let's say the judge says no possibility of you cannot claim on any retirement benefits. Well, that's private retirement or other retirement, you know, through work. That's the one you would get, you know, I would get from my government agency. But that does not affect Social Security. So the reason is because it's not going to reduce the benefit to your ex-spouse if you claim on their record. As much as you would want that to happen, it doesn't. It's not going to reduce their payment in any way. But the same eligibility computation applies, so it's that same 50%. You could be eligible for 50% of your ex-spouse's amount if it's more than what you're going to receive on your full amount. So on your 100%, just like with a spouse, it would have to be more than what your spouse would receive at 50%. So that's how it works. And the thing about with divorced spouses is, you know how I mentioned the bank account has to be opened at 62 by your spouse in order for you to file? Well, if you're an ex-spouse, all that matters is your ex-spouse is 62 and of course paid into the system, eligible, and you become 62. Because if we had that same requirement for your ex-spouse to open up the bank account, that might not happen. Because, you know, I know for a fact with my ex-spouses, plural, I would probably hold off on filing if I knew it would keep them from getting a benefit. I admit that. But that doesn't happen in this situation. That's why we do this. So as long as your ex-spouse is 62 and you meet all that other criteria, you can file off of their record. Deemed filing. What this means is when you come into Social Security and you qualify for spouses or divorced spouses, you can't just file for that, even if it's lower. You can't go for the lower amount and hop over to yours when it gets to be larger. That doesn't happen with with a spouse, a current spouse or current ex-spouse that is living. You are deemed to file for any benefit we can get you at that time. So we pay you on the highest benefit. That's how we do it. It used to happen prior to 2016, but it doesn't anymore. And a lot of reasons we do these changes is because of the trust fund. We always want to make sure it's still there for everybody. Voluntary suspension. This was another change after 2016. If you were to take your retirement benefit, but you decide to suspend it to earn delayed retirement credits, let's say you want to keep working, earn some more credits on there, add it on. Well, then if you suspend your benefit, anybody that receives benefits off of your record, like your spouse or your dependents, except for a divorced spouse, will generally not be able to receive benefits on your Social Security. So you suspend it, everybody else gets suspended, except for a divorced spouse. Government pension offset, this is connected to that windfall elimination provision. It follows you as a spouse or as a widower. So if you worked for a pension that didn't pay into Social Security and paid into the pension, over time, and you're going to get that pension and you're going to get a lot less Social Security because you're offset with that amount. It follows you. It follows the number holder that gets the pension. So survivor benefits, that's another huge topic. When you pass away, your surviving spouse can receive benefits off of your record. So what they can do is they can actually file off of your record as early as age 50 if they're considered disabled under Social Security rules. Now, 60 is the earliest to file retirement benefits as a widower. So widowers are able to file 2 years earlier off of their deceased spouse's record. And they receive a higher amount. 71.5% is what they would receive, not that 50% if the spouse is alive. It increases just like retirement, just like, spousal benefits. Each year you defer receiving it. But widowers actually have another option, and that is because they go to they look at it as there was 2 earners, and now there's only going to be 1 in the household. They can file at age 60 as a surviving spouse, but they can hold off on filing for their own benefit on their record and let it grow. My mom did this. I always use myself as an example. So my mother was widowed very young, and she did not work outside of the home. So at 47, she was widowed, and 48, we made her get a job because she was driving us nuts. We were already older and out of the house. So she started working later in life. So my dad, luckily, he was self-employed, but he always paid into Social Security. So he did get a benefit, and because he did pass away younger, he didn't have tons of earnings, to receive this huge benefit. My mom got 71.5% as a widow at age 60. Then when she was 65 and it was time to file for Medicare, she decided, well, she looked at her benefit, they showed her, and she had surpassed what she would receive as a widower, and she was able to switch over to her own. Widowers can do this. If your spouse is alive, you can't do that. But if your spouse passes away, you are able to file on their record and then hop over to your own later on. You can defer receiving it to age 70 and let it grow to that 132% if you'd like. Your children also, off of that 6.2%, your children are eligible for a benefit if something was to happen to you. So as survivors, if they are under age 18, unmarried, and still in high school, they can receive benefits off your record. Now, let's say they graduate not till May, but they turn 19 in December and they're still going to be in high school. Well, they'll continue getting benefits for that few months, even though they're 19 and still in high school. They also could receive benefits past age 18 if we determine them disabled under Social Security rules. So let's say you have a child, they're significantly disabled prior to age 18, or they become disabled prior to age 22, and they were receiving benefits as a surviving child. They can file for disability and continue receiving that benefit. They would file with us, be determined disabled under our rules, and continue getting that benefit into adulthood. They would just have those medical reviews. We do medical reviews between 1 to 7 years, depending on the disability. So this is the way. There's more. So retirement benefits, spousal benefits, and survivor benefits are part of that percentage that you pay into FICA. So auxiliary, it's a fancy word I say for alive. If you are getting a benefit because you are retired or disabled through Social Security, your minor children, same rules, can receive a benefit. 18 or 19, but they're still in high school. Same thing if they are determined disabled prior to age 22, and it can be proven with Social Security when they file, they can continue on that benefit. So this sounds morbid. I like to joke. I use a lot of humor when I speak. It's just who I am. My dad always used to tell my mom jokingly that he was going to be worth more dead than alive. Well, sadly, he was. Poor mom. She was able to get more on widowers' benefits than she would have if he would have been alive. And of course, that never replaces anybody, but it really did help because he did not have a private pension. So spouse living 50%, spouse deceased 71.5%. The maximum you could get off of your spouse's record if they're alive and you both are receiving is 50%. Surviving spouse, it's 100%. It's a lot more. And that is because you're going down to that one income household. So as a widower, you have the option to switch over to your benefit. Let's say you file at 60, you can hold off getting your benefit to as late as age 70. Are you going to pay federal taxes on your benefits? It depends. So you could possibly pay federal income tax on Social Security benefits. But what that depends on is how much you make your combined income, you could have to pay taxes on it. So between 25 and 34,000 as a single filer, there's a possibility you could pay taxes on it. So you do have to look into that when you decide to take retirement. Will they be taxable? Is this going to add to your, your tax bracket? Is it going to make it go higher? But just know we don't answer tax questions at Social Security, but if you go to irs.gov, they will have great information, and that website is referenced to at the bottom of this slide. So we go on adjusted gross income plus whatever non-taxable interest, and then we count half of your Social Security benefits, and that's what that combined income is, that 25 to 34,000 if you're single, a little bit more if you are married. So unexpected, what we mean by that is disability. So on top of that percentage, there is disability insurance. So with Social Security, you can file for disability with us. Now, we do have a definition of disability, and it's has to be a significant medical condition that's expected to last at least 12 months or result in death, and you are unable to work at a substantial gainful activity limit. And I'll explain that in the next slide. Plus, you have to have a recent work test. Now, we're not going to expect somebody who is disabled at age 25, they become disabled, they've been working for a few years, maybe since age 18, that only gives them a few years to pay into the system. We're not going to make them, like retirement benefits, have that 10 years of work. That's not possible. So depending on your age, there is less work credits that have to happen in order for you to qualify for disability insurance. When you get older and you're past that 10 years amount, what happens to happen is the last 5 out of 10 years, you have to have been paying into Social Security and getting quarters. We call it insurance, disability insurance. Think of it like car insurance. You've got to keep paying into insurance in order for it to be there when something happens. So that's disability. With retirement, once you get that 10 years in, you're vested in. So supplemental security income, I had mentioned that earlier, that there are individuals who receive both SSDI, Social Security Disability Insurance, or retirement benefits and supplemental security income. It's a federal program also. It's a supplemental program. It's for individuals that have limited income and resources. It's for individuals that are 65 and older, or any age, even children, if they're considered disabled. But there are limited income and resources, so you have to meet that criteria first before you can file for this program. The maximum anybody can receive on it is $941 for 2023. It goes up each year with the cost of living increase. So if somebody is receiving less than that, maybe they're on retirement, they don't receive anything but their retirement benefits, they have less than $2,000 in assets, excluding their home and their vehicle, we don't count that. You might want to have them reach out to us and see if they qualify. So under 65, you've got to be considered disabled. Over 65, you're aged. So 65 would need a medical decision through Social Security. Over 65, most people don't have to do that. So this is just describing the two programs and what each pays, how they pay. So think of, we like close acronyms also. SSDI is Social Security Disability Insurance. SSI is that supplemental security income. SSDI, the payments come from the Social Security trust funds that you pay into. So the money you pay into off of that percentage goes towards disability insurance. Now, SSI comes from the General Treasury Fund, completely separate. That comes from federal taxes. And that is a needs-based program. A lot of times people, always think they're filing for supplemental security income because, there's commercials on it. So that kind of gets in everyone's head. But don't worry, we know the difference, that we always make sure you're filing for every benefit possible when you come speak to us. So disability, Social Security, you've always heard rumors of, oh no, they deny you 2 times before they approve you if you're filing for disability. Well, that's not the case. They look at age, they look at if you're still working, if you can file, how much you worked, where you worked, what did you do? They look at everything, and everything we do as government has to be out there. And so the Social Security Blue Book is online if you are filing for disability for yourself, for a child, helping your spouse, helping a friend. This way you can actually see the medical criteria and what you have to have that follows with that from your disabling condition. It's a very big book, so we don't print it, so it's only available online. But it's an amazing resource, especially if you help others file as a profession or you just help your family members. So we have lots of appeal rights. If you disagree with that decision, well, you can appeal it. There are 3 levels of appeal, but you always make sure you're within that 60 days of appealing. You have that time frame. We actually give you 65 because we include mailing time if you don't go online. So there's an initial, if you are denied at the initial level, there's a reconsideration. That's your first appeal. If you're denied at that, then we go into an administrative law judge. You want to see a judge over this. Then if you're denied at that level, there is one higher level of appeal, and that is the appeals council level, and you can file there. So there are lots of levels of appeal. There's appeal rights even with retirement. So the Red Book, this is if you are on disability and you want to work. Please look into this book. It tells you about all these employment supports, especially if you're on SSDI and SSI. It's a great tool if you want to get back to work, and the criteria and what happens if you do get back to work. How does that affect your Social Security disability insurance? How does it affect your SSI? So advanced designation, I slide into this. This is new. This just happened last year. They're representative payees. We have our own I'm going to use a word, power of attorney, but we don't recognize power of attorney with Social Security. So if you were to come in helping your parent and say, well, I've got power of attorney, you can give me all their information. We can't. They have to sign a release form, or if you're dealing with their affairs, you would need to file as their representative payee. Now, we would need, if they've been receiving along, let's say they start getting dementia, or they have significant memory loss, they would need a doctor to sign off. We'll always explain how this goes. And the doctor would let us know this doesn't mean they're incompetent. What it means is right now they're incapable of managing their own money, and they're going to need a representative payee to help them manage that money. You would assist them with managing their Social Security benefit, and you would be the one that we deal with. You would be able to change their address, bank account, give us information, report any changes. So now you can choose up to 3 people you would want to do that when you file for retirement or disability. Before, we would have to choose the best person. Now you're able to do that. So you can go back in online and you can do this. This is a really big deal. I like to joke, if you don't really like your children anymore and you don't want them to help you and you already know this, hey, you can pick 3 friends. So it gives you that option. So I'm going to touch really quickly on Medicare because I want to give, a few minutes for this so we have some time for questions. We are the gatekeepers of Medicare. We don't advise you on what plan to take, anything like that. We can't tell you what Medicare pays out. Plain Medicare pays 80%. A is your hospital insurance. So if you've paid 30 credits into Social Security, then your Medicare Part A insurance will be free at age 65. So maybe you're still working and getting employer health coverage and you don't want to file at 65 for Part B, which is the actual meat and potatoes Medicare, the medical insurance. Still file for Part A. If you know it's going to be free, you might as well file for it. That's what I always say. B is the main one. Eligibility starts when you're 65, 3 months before and 3 months after. D is a drug plan. So B, if you're just getting plain Medicare, they don't have a drug plan on there. You have to add Part D. Think D for drugs. C is your advantage plans. I call them designer Medicare because there's specific plans that can cover specific things. They will have a prescription drug plan in there usually, a vision plan, hearing, possibly dental. So if you go to medicare.gov, you're going to be able to see those plans. You just type in your zip code and it'll pull up where you live and how many plans are available to you and what they cover. And you're going to be able to kind of pick, like you do when you shop for a car, what you're going to need. So eligibility for Medicare 65, 3 months before, 3 months after. If you go into kidney failure at any age and you're getting dialysis, you can file for Medicare. Or if you're receiving Social Security disability insurance for 2 years of payments, you're going to be eligible for Medicare. So you may know somebody that's 40 years old, but they're getting Medicare. Well, it's because they're receiving Social Security disability insurance possibly. ALS, Lou Gehrig's disease, you can get it at any age. So another enrollment period is the general enrollment. Let's say you didn't want to file at 65. You were retired, you were getting covered under that insurance, you felt you didn't need it, you didn't want to pay for it. And a couple of years down the road, you realize, well, maybe I do need that second coverage. So you would be going into a general enrollment period, and that's each year happening, almost ending right now, January 1st through March 31st. That is the general enrollment period. Just like your regular health insurance, if you're working, with an employer or retiree, there's this general time when you can get a plan. So that's what happens with Medicare. Now, a special enrollment period. So if you miss filing at 65 and you're not currently covered under a group health plan coverage through yourself or your employer. Now, group plan means you're actively working. You or your spouse are actively working for this employer and covered under their group plan. So you would be eligible for special enrollment. Let's say at 65, your spouse is still working, you're covered under their plan, and they stop working when you're 68 years old. Well, you have 8 months to get in the door and file, and that way you don't get a penalty. Because if you're not covered, with this special enrollment period and you miss the special enrollment and you miss age 65, well, you get a 10% penalty each year. So, and there's no cap on that penalty. It keeps adding up. So just remember that. This just goes over the coverage. It's exactly what I just tell you, but it tells you when it starts. And this is all available on our website. These slides are available to share. And you always want to make sure you know when you're going to get covered. Now, 2023, if you're making $97,000 or less, your standard premium is $164.90. That is your modified adjusted gross income. Now, it can be higher. The more you make after it's adjusted, the higher your premium is going to be when you turn 65. So just know this. And we go on the tax returns 2 years prior, IRS. So you may have sold your house during this big boom a couple years ago, and we see that your income's really high. We don't know where it comes from because we just interface with the IRS. We don't see the actual tax return. So your premium jumps up, and we're charging you from your retirement benefit, another $164 on it. Well, you can come to us and let us know this. Well, no, this was because I sold a house, and there's a paper you would fill out and we can get this adjusted for you. But if this is your constant income, you're going to see that amount. Medicare.gov, I mentioned it earlier. Extra help with Medicare prescription drug plan costs. This is for individuals. We can possibly help you with that premium because it does cost a premium, that Part D, if you have basic Medicare. It's needs-based. Please reach out to us, look on our website, or help your family member because we could help pay that premium each year for them or an amount. So I hope that helped a little bit with everything. We are available on social media. And just know really quick, Jenny, things change. So, this could be being recorded. Things do change with the agency. So maybe my numbers, if you come back a few months later and see it's not right, it's because things change. And please, our website is always updated, always updated. So always check our website also or call.
Yeah, that's a great thing to note because you're right. People will see the replay, and while the information is solid throughout, yeah, the numbers and policies and things like that may fluctuate. Okay, we've got like a couple minutes for questions. We're going to do really rapid fire here. And you may have addressed this, but let's see if this is clear here. If you pass away and do not have a spouse, what happens to your Social Security income?
So if you pass away and you don't have a spouse, then that benefit just goes into the trust fund, helping people pay. So those of us paying now are paying for individuals that are receiving. I use my hands, sorry. So it would just be there unless you had minor children that could receive on it. But otherwise, what it does is it help funds the Social Security program.
Okay, understood. But if you do have children that are 18 or younger, then it would go to them.
Yes.
Until they're 18?
Yes, or 19 and still in high school. So like I said, they may graduate in May, but they have a late birthday. They could continue getting it.
Got it. And then do you have to, anybody watching this, and people are coming from all over the world sometimes and experiencing life in the US, but sometimes new experience and things like that, that maybe their parents didn't do this. Does anybody have to do anything specifically aside from just show up at work during their working years to be a part of receiving Social Security later?
As long as you are working and those FICA taxes are being taken out, that's it. You just have to if you pass away, then your survivors, they just have to reach out to us.
Okay. And let's say somebody is a freelancer or I'm thinking of particular professions. Maybe perhaps they are a professional housekeeper or they work on their own doing graphic design for somebody or something like that, where they're not going to an employer. How do they then make sure? Is it just by paying their taxes?
Pay your FICA taxes. Pay your payroll taxes. It's like I mentioned, it's very different than your federal taxes at the end of the year or your state's gross receipts taxes. Make sure you pay the FICA taxes. You have, like my dad did. He wasn't always happy about it, and he did it for his employees. But thank goodness he did, because one of them, my uncle, passed away, and then your children can receive off your benefit or your spouse. So you have to pay that full amount. It's higher because, I was saying about 6.2% and then 1.45% is what we pay with an employer paying the rest. Well, you got to pay that full percentage when you're self-employed.
So I think it's important for people to remember, people who are maybe like, oh, I'm doing a freelance gig here, a thing there, and maybe not participate, however they may be doing it, that this wouldn't necessarily be a benefit for them down the road, or they may not, have that coming.
Right. Especially if you have minor children, especially if you have a spouse, you're going to want to make sure that you do pay those taxes. It's up to you. I mean, everybody, you do your own taxes. I can't advise you tax wise.
Yeah.
If you pay into it, and you pay enough, you have to get that 10 years, those 4 quarters in, you're going to be insured. Think of it like car insurance. That's what I always say.
What if somebody's watching this right now and they are 60 years old and they have not participated before? Maybe they were a stay-at-home, part of their family, maybe they work within the household, but didn't earn income outside of the household, and they're 60 and they're like, hey, I think I've got 10 years in me. Can you start then?
Yes, you can start at any age. You just, so you wouldn't be eligible. Let's say you didn't work at all. You don't have a spouse that qualified at the time. Maybe they didn't work, or like I said, they were self-employed, worked in another area. Then yeah, you could just start paying it in. Once you get it paid in, then you're eligible to receive on it.
And it's not 10 years in a row.
No, it's
So
it's a
maybe you
total
did 5 before you had kids or something.
exactly. It's 40 credits. That's the main thing.
The credits, yeah.
Credits. As long as you get that before you file, then you're going to be eligible.
And so it just depends too, like for some people, if they're working part-time, then the credits wouldn't add up like it would for somebody.
Slower. It's a little slower because you have to make a certain amount. That 16, I apologize, I'm going to say 1650. I don't have that number memorized all the time. That's how much one credit costs. So you have to pay FICA taxes on those wages. So if you're part-time, make sure, you're paying it on a certain amount. If you're self-employed, that way you can start getting those credits for yourself.
How many credits again?
40.
40 credits. 40 credits of 1650.
Yes, right now it goes up each year. So, but 1650 is going to be the baseline. You got to make sure. Yeah, it goes up a little bit each year, the cost of them.
Okay, got it. Well, listen, I have so many more questions, but it's great to leave in a place where you're desiring more and wanting more information from somebody, especially when you're going to get to see them in a week. So yes. This was great. Rhonda, thank you so much. I appreciate the time today, and we'll see you next week.
And thank you guys for inviting.
Yes, so it's been our pleasure, and I'm hearing from a couple of you saying, listen, I am in my 60s and 70s, and I already know a lot of this, and so kudos to you. Hopefully, and I know some of you aren't, so you're learning a lot right along with us. Don't forget, for more on Sarah National's programs and for the replays of all of these sessions, they've all been incredibly robust and valuable and interesting. They are all on the YouTube channel, and that is in the chat, and we're getting some kudos for you too, by the way, saying wonderful session and thank you for the information. So I hope that you leave feeling fulfilled, like you taught us something.
Oh, good. That's always awesome to hear. So thank you all so much for the invite again.
And don't forget, we'll see you all at the Creating Gateways to Economic Equity, Sarah National's 59th Annual Conference on May 10th. And I will see you all in 1 week. Same time, same place. Talk to you soon. Bye, everybody.